Welcome to this series of infectious diseases talk. I am Ed Ong. I am actually a consultant physician in general internal medicine with an interest in infectious diseases. I'm now going to introduce to you, the key importance of hand hygiene. This is a very well-renowned physician who in the 1818 was an assistant to a professor of maternity clinic at Vienna General Hospital. He introduced hand washing using chlorinated lime for interns who was working at that time because he was witnessing a lot of what we call purpura sepsis. It's actually a real problem during that period of time, and unfortunately we still see it nowadays. At that time when he introduced this, he was ridiculed by the hand washing theory. But look at the evidence here. The evidence showed that when he actually introduced the hand wash, the number of cases that actually dropped was quite remarkable. So he is actually widely known as the father of infection control. So what are the key 5 moments of hand hygiene? Very important. In particularly clinical setting where you have got, before you touch the patient, you must wash your hands. Before you actually do any clean or aseptic procedure, you must again clean your hand, wash your hand, and particularly if you have been exposed to any bodily fluids, your hand must be washed as well. Furthermore then, after you have examined or seen or even shaken hands with the patient, you must also wash your hands. And remember what I talked about environmental cleaning previously. Also, after touching the patient environmental surroundings, that hands must be washed diligently. So it's universal, in the context that hand washing, usually with soap and water, is probably one of the best. Alcohol-based sanitizer, which has become very popular, particularly during the COVID-19 pandemic era. So you can see how the evidence shows how hand hygiene actually works in that context. What are the alcohol-based sanitizer that you should actually be using in that context? Yes, there are recommendations, particularly from WHO. So these are the recommendations, and in any case, all the recommendation is that the alcohol content of your sanitizer must be at least 75% for it to be effective. How do you wash your hand effectively? People keep asking. Yes, it's very important. Palm to palm, as shown in number 1. Between fingers, number 2. Number 3, back of the hands. Number 4, base of the thumbs. Number 5, back of the fingers. Number 6, fingernails. Number 7, wrist. Number 8, rinse and wipe dry. Lots of evidence also has been shown, in the context to see, even if you do that, what are the areas of the hand that does get missed? Wow, look at this. The palm, they get missed. The tips where your fingernails are get missed. Interweb space, in between the fingers. Back of your hand, front of your hand, most frequently missed, less frequently missed in that context. So I think it's quite important how you actually wash your hands properly in that context.
We hope that you have learnt more about hand hygiene. Look out for episode 4, where Dr. Edmund Ong delves deeper into the fundamental principles of control transmission and more. Stay tuned.